Good afternoon and welcome to Delivering Workplace Wellbeing, a live stream panel discussion and broadcast that will reimagine productivity and health in the post-COVID era. Today's live stream broadcast is brought to you by MEED together with Cigna.
Thanks, Richard, for the introduction. Great to be with all of you this morning and to share with you our thoughts around both what happened during the pandemic in terms of COVID impact, but also in terms of productivity and well-being in the workplace. To start with, I wanted to share with you some insight around Cigna, who we are and what we do. So Cigna is one of the largest health service companies in the world. We are ranked number 13th on the Fortune 500 in the world. When we think about the world of today, there are a couple of things that have really changed since the pandemic. The first one is obviously more and more we have remote meetings as we do today. We are, all of us, working partially from home, partially in the offices. So it has really changed the way we work. And also, I think we also have seen the huge pressure on all the healthcare system. Some of them have been able to react quite well, like in the UAE region. But in other parts of the world, as we have seen, some of the healthcare system have really struggled during this pandemic.
Well, thank you, Jerome, for that excellent presentation. You presented some very important and interesting data, and I think your keynote remarks set up the discussion for the next hour or so perfectly. What for you is the key trend or the most important aspect of sort of the stress levels facing employees in the current environment and, in the post-COVID environment?
Yeah, you're absolutely right, Richard. I think stress and mental health is definitely one of the key highlights of all what we've lived, through during both 2020 and also 2021 with the impact of the pandemic. So, a couple of key highlights here. First, as we can see, there is a strong correlation between stress and mental health. So it's definitely, linked. The two notions are very linked. The second aspect is the level of stress is really, really high. That's what we can see in the study. And in the UAE, we have, unfortunately, one of the highest level compared to many other markets across the world. And there are a couple of reasons for that, both around working hours, working on the weekend. But more importantly, I think the key highlight in the region is really the fact that people have a kind of always on culture. So what it means is the first thing people are usually doing when they wake up in the morning is, switching on their smartphone, checking their emails, whatever they have. And then they do that all over the day and until probably the last thing we do before we sleep as well.
The pandemic has obviously had an impact, but I think it's important to remember that we've spent the past 50 to 60 years perfecting what I call destructive productivity habits. We work and live in ways that are opposite to what our brains and bodies were built for. And this has really caused an absolute avalanche, as we know, of physical and mental illnesses. And the pandemic has just simply added another layer of complexity and severity to what I think is actually a much more an already existing silent pandemic.
Now we had the time to look at how people work, to the point of what Linda has mentioned, how people are working and how we can bring more healthy way of working. And we've seen like offices saying, you know what, we took the time of the pandemic to relook at our office space, to look at the way we are set up, to have a desk that goes up and down, to have more, chairs that are more ergonomic, to relook at the way we set up meetings, instead of 1 hour, 2 hours, why don't we do 50 minutes meetings? So we have a hard stop and we give 10 minutes to people to just take a break. And so all of those, that's the organization that must think about that and provide the guidelines. So that's in a nutshell.
Before COVID, when people were predominantly working from an office environment, having any kind of well-being issue was probably first observed by colleagues, line managers, people around the office. So employers had sort of the obligation, but the opportunity to train these colleagues and to how to support such cases. Now, with with the blended working environment, or in the past year, working from home, this role has actually shifted to the family members. So the spouses, all the kids who are old enough to observe certain behavioral changes, knowledgeable, etc. So what we try to achieve, and we are in very early stages of that one, is to reach out to the family members, to let them know that what resources we're providing for their EY working spouse, what services they can actually be covered, because EAP services does cover dependents. Medical insurance does cover them. So we want to engage them and make sure that they're equally aware of the opportunities that we provide for the for our employees.
For me, it's a very simple principle that I always share with my team member is we should all remind that thinking is also working. So many people believe that actually, I'm good if I've got a full schedule all day long. But it's not the purpose of any company. The purpose of any company is to deliver what is expected as a global promise to your customers. So ultimately, thinking is also working. We need to make sure we step back and we do more efficient things and more important things and only the urgent things. Because otherwise, you can focus all your day on urgent topics. It doesn't mean that you will provide the right added value from a global perspective. So for me, there are a couple of things and principles and values we need to make sure we apply on a daily basis to make sure that we deliver the best output in terms of performance with all our team members.
I want to thank the panelists, to Christine, Linda, Jerome, and Peter, for their time and expertise. It's been a fantastic conversation. I mean, so many big topics. We clearly need to do this again to get into some more detail on that. But thank you to all four of you. And Jerome, thank you to Cigna for making this happen today, for partnering with MEED for this broadcast. Stay safe. See you soon. Thank you very much.
Bye.
Thank you so much.